investigations. So for the investigations, you need to know that what? You have to investigate the disease, you investigate the cause, you investigate complication, the background, the prognosis. So we start by investigation in acute kidney injury. So when you want to investigate acute kidney injury, you start by investigating the acute kidney injury and chronic kidney disease. Generally, the investigation is similar. You have to investigate for renal failure. When you want to investigate for renal failure, you just ask for the creatinine level and then you measure the glomerular filtration rate. Is it clear? So the urea and creatinine level and then you measure the glomerular filtration rate. Another method of measuring the renal function is also by the method of inulin infusion. Normally that is the perfect method of measurement of glomerular filtration rate, where you infuse a patient with inulin. Is it clear? You infuse a patient with inulin and then you are going to measure the glomerular filtration rate, because inulin is completely filtrated at the level of the glomerulus. Is it clear? You can use inulin, but now what is good with creatinine is that creatinine is intrinsic. Is it clear? And then it is produced from the body. You don't need to place inulin in the body in order to calculate its output. Is it clear? Which is going to be very expensive. So just measure the creatinine level and then you measure the glomerular filtration rate. Is it clear? To know at which level of classification you have. Now, after doing for the creatinine level by knowing the urea creatinine level for the renal failure, you have to evaluate which mechanism which mechanism or the level of the injury. Is it clear? Now, we had in acute kidney injury, we had acute glomerulonephritis, we had acute tubular necrosis, and we had acute interstitial nephritis. Is it clear? Now, we need to know that in acute glomerulonephritis, you have to ask for a urinalysis. Is it clear? Generally, in acute glomerulonephritis, the urinalysis is going to show you, since it's affecting the glomerulus, you're going to have a glomerular range proteinuria or a nephrotic range proteinuria. Is it clear? So at least a 2+ or 3+, or you have a nephrotic range proteinuria of 4+. Is it clear? So you have a glomerular range proteinuria or a nephrotic range proteinuria since affect the glomerulus. Is it clear? So that's on urinalysis. And also you may have a hematuria. Is it clear? On urinalysis. Urine dipstick. Is it clear? On the dipstick. Now, on the microscopy, what are you going to visualize? In the microscopy of the acute glomerulonephritis, you see that the red blood cells are going to be Mickey Mouse appearance. Is it clear? You are going to have Mickey Mouse appearance of the red blood cells. That is nephrologic hematuria. You are going to have Mickey Mouse appearance or dysmorphic red blood cells, and you are going to also see the red blood cell casts. Is it clear? So all that is going to be shown in the case of acute glomerulonephritis when we are doing dipstick and microscopy. Now for acute